Spectrum Health opening their new Women's Health and Wellness Center next week, making it easier to get a broad range of services.
And that includes bone health consultations. Annie Satowski shows us why that's so important in this week's Medical Moment.
82% of women who had just suffered a fracture were not aware that they now have the new diagnosis of osteoporosis.
Osteoporosis, or a loss of bone structure, is a normal part of aging. Dr. Jeff Knibbie, an internal medicine doctor with Spectrum Health, calls it a silent part of a woman's health.
I feel very strongly and have had the privilege in the past of showing women how important it is to get that screen and to get the simple testing done that can identify the next step for their bones.
But Dr. Knibbie doesn't want people to wait until they get a fracture to learn about their bone health.
We know that for most women, the risk begins when their estrogen levels go down. So around the time of menopause, whether that be earlier in your 40s or around the typical age, around age 50, that's the best time to get a baseline bone density performed.
And Spectrum Health can help through a simple screening process, starting with some standard questions.
We ask questions about their family history and their genetics, and then we focus on their social habits, their exercise, their nutrition. And we try to get a full picture of how long they've had it and what the causes are.
The bone density scan itself is also easy and painless.
The process of getting a bone density, fortunately, is very simple, it's easy, and it's fairly quick. There are bone density machines scattered around the city. Each one of them is like an x-ray table that you would lie on. They would then have an arm that would come over you that would take a very low energy x-ray, standard x-ray of your hips and your spine. Each snapshot picture only takes a second, and then the images are read for how dense or how much calcium is in the bone, and that score that is assigned compares you to your peers.
Then patients and doctors work together on the next best steps.
And then at the follow-up visit, we'll put the whole package together and make a special plan for them. It might include some physical therapy, some exercises. We might talk about boosting their calcium intake or assessing their vitamin D.
Dr. Knibbie says it's a thing that often gets overlooked, but plays a crucial role in your overall health.
To make an appointment or learn more about Spectrum's new Women's Health Center, you can call the number or visit the website right there on your screen.